had a lot of people ask me to do a recording video such as this to explain the benefits and the features of the incredible programs that AWIS is putting out there. You know, there's over 63 million people in this country with no health care coverage that we can help, and also those that do carry major medical HMOs and PPOs, how we're actually lowering their costs, helping them with their deductibles, and making it a little bit more comfortable for them to have the incredible coverage of AWIS along with their major medical plans. American Workers Insurance Services and Family Care, it is a licensed and registered insurance agency marketing comprehensive major medical and life insurance, you know, through licensed insurance agents, as well as affordable association healthcare. That's what we do here. Plans with limited group insurance benefits marketed by individuals, companies, and organizations, licensed and unlicensed. There are 3 types of healthcare programs in the country. It's very important to understand what 3 types are available to us. Government, Medicare, and Medicaid, again, you have to be of a certain age and you have to qualify. HMOs and PPOs, which is most of us understand, you know, Blue Cross, Blue Shield, very, very expensive, hard to qualify for, high deductibles, those types of things. And association healthcare, and that's what we are with American Workers Insurance Services. Something I knew wasn't even available. I had no idea what association healthcare was, but found out that it's been around longer than the other 2 put together, where you can get discount plans and limited group insurance benefits for a very low cost, and that's what I'm going to be going over here in the next few minutes. Now, American Workers Insurance Services limited group insurance benefits are actually underwritten by all the major medical insurance companies like U.S. Fire, Hartford Life, Crum & Forster, which has been around since the late 1800s, all A-rated on the AM Best for paying their bills on time and paying your medical bills. And being a customer for about 1.5 years now, with a lot of my friends that have these plans as well, I've been able to utilize all of the benefits. In fact, you know, saw one from U.S. Fire and Insurance on my roommate's desk the other day for $3,300 paid by U.S. Fire and Insurance. His son crashed on our motocross track and had to take him to the emergency room. So really incredible to be A-rated for all the people that we do business with. Also, our vendors and affiliates, you know, again, companies that you've heard about like Quest Diagnostics, Presidential Life, U.S. Fire and Insurance, those types of companies are all our vendors. And the PPNI network, that's something that you might want to write down, ppnusa.com. We have a group of over 400,000 doctors that are in our network, all contracted at Medicare and Medicaid rates. We're able to give them business and then also make sure that you're getting the best rates possible when you need to see the doctor. So again, ppnusa.com, free to join our network, and you might want to recommend that to your doctors as well. Now, we all know that healthcare is in a state of crisis. It's the hottest topic in America, you know, affordable healthcare. You can't turn on the news or the radio or anything without really having that as the topic, even at the barbershop or wherever you're at. You know, people are talking about, you know, having affordable healthcare. 60 million people in our country right now have no health insurance, and that number is growing. Again, over half of small businesses do not offer health care to their employees, and even the ones that do, most of the employees cannot afford to add their families on to their plans. So some of the, you know, part of the family's insured, part of them are running around with no insurance. And insurance companies are reducing benefits. Regular major corporations are dropping their health care just to stay in the business. And, you know, you have to make, you know, over $10,000 a year just for your health care, you know, especially those that are self-employed. You know, paying very high deductibles out of your pocket before you even can utilize your insurance. So a lot of different things that are going on here that are creating the crisis of why people don't have any health care today. Now, we do business in 47 of 50 states. The only 3 states we don't do business in are Montana, North Dakota, and Massachusetts. Right now, you're looking at a license. We are licensed in every state that requires a license. In fact, we are the only company in the state of California to ever receive a DMPO license to be able to do these types of plans in the state of California. Now, a couple things, unlike the other 2 types of healthcare programs, everybody qualifies. There are no Social Security numbers required. There are no health restrictions. So if you have pre-existing conditions, you are still accepted into our program. Plans are affordable to get and keep, and there's little or no deductibles. In fact, there's only one deductible on one of the benefits that we have that we're going to go over here in the next few minutes. Now, a few questions I want to ask you. You know, if you go to the hospital emergency room or even to the doctor because of an accident, the first question they ask you is, do you have health insurance? Now, wouldn't you think that it'd be the best if they asked what was wrong with you? But they want to know if you have insurance. And if you say no, how do they treat you? Not very good. You know, you might not even get treated at all. And how do you feel about that? Well, if I have one of my kids with me and they're hurt and I don't have any health care and I don't have a card to pull out, man, it's not a good feeling because you're going to get sent to the end of the line for sure, even if they're going to see you at all. Now, also, when they eventually treat you and you go home within 30 to 45 days, you could receive a bill for $900, $2,000, $4,000 or more. How are you going to pay that bill? Over 50% of bankruptcies in this country are because of medical bills. With our plans, you're going to be able to have that card that you can walk in and say, yes, I have coverage, and we can definitely help you. So now let's take a look at three of the plans that we have, three of the most popular plans. Now, depending on what state you're in, they're going to all be a little bit different. Maybe a little difference in the price and a little difference in the benefits, because the ability to do bundled plans along with unbundled plans depending on state regulations. So we're going to look at in box number one is a $59.95 plan a month for a single individual, or $69.95 for a family. Box number two is both a single or a family, $99.95 a month. That's going to be the price. And box number three is $169 for an individual and $199 for a family. Now, the best thing to do is take a look at where you're at right now and just say, what's my budget? We can upgrade and downgrade at any time. There's no contracts. So you can just apply right online, and there's an 800 number for any questions that you have. And if you wanted to upgrade to another plan or downgrade 1 month because funds are tight, you can do that. So very, very simple to be able to do that. So let's take a look at the $59 plan. Again, $69 for a family. There's a one-time application fee of $100. And so the first month, if you're an individual, would be $159.95 and $59.95 from there forward. Now, in 28 years of being in business, Family Care, they've never raised the rate on a single member, ever. So if your rate's $59.95 and you keep that plan for as long as you keep it, that's going to be the price. So that you're not going to have those major increases that you're seeing with all of the other insurance companies that are out there. Again, a one-time application fee, and in the first 30 days, you're going to be able to utilize the benefits, the discount benefits that you see in blue. And 30 days later, there's a 30-day waiting period for the limited group insurance benefits to be added onto your program. So let's run down them real quick. You got pet care through our Pet Assure program. Pet Assure is one of the largest pet organizations in the country. It gives you 10 to 30% off your pet care needs, such as pet food or veterinary services. So you'll simply fill out the form that comes in your packet when you get it, send it in, they'll send you a card from Pet Assure, and you can use that and start saving money there. Legal services. We have attorneys on staff that'll give you 30-minute free consultations for any issues that you might have that you run into that you need help with. Again, unlimited amounts that you need them for different events that happen. Now, our hospital patient advocacy, this is probably one of the best benefits that you're going to have by being a member of Family Care and AWIS. And this is a professional negotiation department that negotiates hospital bills. Now, check this out. The best state in the country overbills the non-insured by 32%. The worst two states in the country, California and Nevada, overbill by 2,000 to 3,000%. So this is a professional organization that negotiates bills for you. In fact, I had a friend that joined Family Care with me, that his wife had a stroke, and they had a $60,000 bill in 4 days at UCLA. Now, this is a bill that they had before they joined. Now, because Kathy has a pre-existing condition, she's not going to get affordable health care anywhere, even if she can get it at all. So they came in, they submitted their bills to the PAC program, and they only paid $10,000 out of a $60,000 bill. So do you think that that was worth it? And that was a bill that they had before they joined Family Care. So our PAC program is incredible to be able to negotiate that down and help you with those large bills. Now, the emergency roadside assistance, again, that's a new program that we have, very, very much like AAA. So if you run out of gas or you flat tire, now the great thing about our roadside assistance is it can be used in all 50 states. So those 4 benefits you can use immediately as soon as you become a member and get your member ID number. Now, the limited group insurance benefits, this is incredible. The number one thing that I found that people are worried about when they have no insurance is an accident. So on a $59 single plan, a $69 family plan, again, that doesn't matter if you have 2 kids or 10 kids, it's going to be $69.95 for the whole family. And you get $5,000 in accidental injury coverage. So if I got hurt, I'm going to have $5,000 in coverage, only a $100 deductible, any hospital, anywhere in the world, and it will be covered. And that's from Fairmont and U.S. Fire Insurance Company. So again, $5,000 in coverage. Imagine how many people out there have liability insurance only on their car. Well, they can have this, and they can have coverage everywhere that they're at. $10,000 in accidental death and dismemberment from Fairmont and U.S. Fire. $100,000 emergency travel. Now, what this is that this is a zero deductible, $100,000 emergency travel program that if you get hurt over 100 miles away from home, they'll airlift you back to where you need to be with $100,000 coverage. So if you're a family of 4, each one of you is going to have $100,000 each in coverage for that accident. We also have brought on Hartford Life, obviously one of the most respected companies in the insurance field. They brought in $15,000 in term life insurance, no questions asked, and another $15,000 in accidental death and dismemberment. So again, for $69 a month, you've got $40,000 in coverage if there was a catastrophic accident. You know, 15,000 AD&D from Hartford, 10,000 from Fairmont, and another 15,000 term life with no questions asked. Everybody is accepted. So that's our least expensive plan. Again, way under $100. You can't even go to Chuck E. Cheese with a family of 4 for that kind of money. You know, you go out to dinner to a decent restaurant. We went to a halfway nice restaurant the other day for my daughter's birthday. There were 3 kids and 2 adults, no alcohol, just dinner, and it was $73. So it was more than this, and I can get a health care plan for my family. Now let's take a look at the next one. We're going to jump up to our $99 plan. Now again, $100 one-time application fee, all of the same discount benefits, but what we've done here is 2 things. One is we've added the $50 doctor reimbursements, the first one there in pink that you'll see, and that's 5 times per year per family member, and there's 3 ways to utilize this benefit. Number 1 is if you use an in-network doctor and the bill is $75, you'll pay $25 and the doctor will get reimbursed the $50. Now if you use an out-of-network doctor like I had to a few weeks ago, I went to the eye doctor and got an appointment, it was $56. Well, I was able to pay the bill, $56. I brought the bill home. I filled out one little simple piece of paper, sent it into the company. They're going to mail me back $50. So I was able to use that even with my eye doctor, chiropractor, anybody, and get that covered. So my doctor visit cost me $6. This one jumps up to $10,000 in accidental injury. So again, I can have an injury today, an injury tomorrow, an injury the next day. My kids could get hurt, and I've got $10,000 in accidental injury coverage, again with a $100 deductible. So that's our $99 plan, a very popular plan. Now our number 1 plan that I've been selling anyway, that people are jumping right to, is our Optimacare Deluxe plan. $169 for an individual, $199 for a family. Now what have we added here? We still have the $50 doctor reimbursements, $10,000 accidental injury, but now we've added a $5,000 critical illness. That's the bottom one there in the brown, and so you have $5,000 critical illness coverage. And then you have hospitalization, the 2 bottom boxes there, $300 per day, hospital, and $600 for ICU. Now, it might not sound like a lot of money, especially when you see the size of hospital bills, but when you see that they overcharge like they do, and you have the ability to utilize the PAC program, it's amazing what this company is doing for people. I'll give you an example. We had a gentleman in the hospital who had an accident, and he was in the hospital for 22 days. He was in ICU for 12 of those days. 600 times 12 is $7,200. He had another 10 days just regular in the hospital. That's $300 a day, another $3,000, and it was an accident. So he had $10,000 there. So he had a little over $20,000 in coverage from his $169 plan. Well, the bill came to $66,000. Now they submitted that to our PAC program, the Hospital Patient Advocacy Program, and they were able to negotiate that bill down to where it cost that gentleman $100. It cost him his deductible. Now also with these plans, you can utilize catastrophic-only insurance. There was an incredible article in the Washington Post talking about how insurance is actually wrong. They try to put everything into one where you really should separate it. Carry a high-deductible, catastrophic-only program, and you can utilize one of our association healthcare programs that will actually cover that deductible. So if you have a $5,000 deductible on your catastrophic program, then you can have a $5,000 critical illness over here, for $169 or $199, that $5,000 critical illness or $10,000 accidental injury will actually cover your deductible. Because currently people are paying, hundreds and hundreds of, and even thousands of dollars a month for major medical insurance, and they're not using it. Well, now we can split that up, get a catastrophic program only, and also have one of our association healthcare programs. Also the $50 doctor reimbursement, if you have catastrophic and you have a copay, you can utilize that to cover your copay. If it's a $10 or $20 copay, you could submit that form and they're still going to send you $50. And the average person sees a doctor 2 to 3 times a year. So those are 3 of the major plans that we have. It's very easy to apply for one of our programs. Simply get back with the person that invited you to take a listen to this recording and log into their site at http:// whatever their site name is, .awiscard.com. Choose the state that you're from, view the available plans. There'll be a drop-down next to each one once you decide on what plan that you want. Pick individual or family and simply take the 2 or 3 minutes to apply and enjoy all of the benefits of American Workers Insurance Services.